I have 6 minutes to make you an expert on the thigh lift. I'm Joubin Gabbay, board certified plastic surgeon in Beverly Hills. I'm the clinical chief of plastic surgery at Cedars-Sinai, and I want to tell you everything about the thigh lift. It's also called the medial thighplasty or any other number of names. There are a lot of reasons to get a thigh lift, but at the core, it's too much skin in that inner thigh, and that can cause a lot of changes all around the thigh. And patients who have thigh lifts typically have lost a good amount of weight and have lost more weight than what their skin can keep up with, because everybody's skin is elastic to a certain extent. So if you lose a little weight, your skin's going to catch up with it and shrink down with you. But beyond a certain point, your skin can't keep up. And the skin will stay while the fat underneath or even the muscle underneath may go away. Patients who are typically in this situation most commonly are those who've undergone significant amounts of weight loss, be it through surgery or weight loss medications, even after pregnancy, or even with significant aging or normal aging. What ends up happening is their skin is loose, potentially all around the thigh, and especially on the inner aspect. It can hang down a little bit, it can be crepey, there's a little bit of looseness and things like that. Now, there is another little subset of patients who are great thigh lift candidates, and those are patients who have lipedema. Lipedema is a special situation where the fat in any part of your body, most commonly the legs, the arms, or even the abdomen, that fat is a little bit different. That fat grows in a way that causes significant bulk, significant changes in that part of the body, and often the fat needs to be taken out. Well, guess what? If you've got a lot of fat in that area and you take it out, again, what's going to happen to the skin? The skin's going to be loose. So keep saying it. At its core is loose skin as the main need to get a thigh lift. So the next question is, and sort of this leads us to the different types of thigh lifts, how much loose skin is there? Where is it located? And what about the rest of the body? Because, usually if you're loose in one area, you're going to be loose somewhere else. So for patients who have a very limited amount of loose skin, mostly in that upper inner thigh near the groin area, some will do what's called the crescent thigh lift, where what we'll do is we'll just take out a little strip of skin in the upper inner area, just below the private parts, and that can lift up and tighten just the uppermost aspect of the skin in that thigh. That's good for a little bit of loose skin. What if you have more than that? What if you have loose skin all along the inner thigh and even along the whole aspect of the leg, the outer aspect and lower aspect? Well, just a little bit of skin up there, it's not going to cut it. So in those cases, we will do what's more of a vertical thigh lift or vertical thighplasty. There are some people out there who get really touchy if you call it a thigh lift, because they say it's not a lift, it's a plasty, it closes it together. All right, whatever, I get it, but we like calling things lift, so we're going to call it a thigh lift. I don't care. With the vertical thigh lift, you make that incision, in my hands, most commonly along the groin crease, down along the inner thigh, often to the level of the knee, sometimes a little higher, sometimes a little lower. We'll every now and then carry it down all the way down the calf, along the inner aspect of the leg, depending on how much looseness you have. That will obviously serve to get rid of all that extra skin on the inner thigh. And what's really amazing about it is that it pulls and tightens the rest of the thigh. It literally can have an effect on the outer aspect of the thigh, which is great. You get a beautiful contour as that result, okay? And then there are other names for thigh lifts, things like the spiral thigh lift. The spiral thigh lift is basically that inner thigh lift that goes up here, goes into the groin, and actually carries along the back of the thigh all the way to your lower back, and typically can incorporate the component of what we call the lower back lift or lower butt or upper butt lift. So it's just about how much loose skin you have and how much of that skin you take out to get that thigh lift done. Now, just as there are many different incisions of the thigh lift, there are a lot of different ways to approach that thigh lift. And this is where I tend to differ from a lot of the older teachings. So I do a lot of things that are unique in my thigh lift, and I absolutely believe are evolved to give the most dramatic result possible with the least amount of trauma to your body and the best recovery possible. My approach to this inner thigh lift is to do what I sometimes call the preservation thigh lift, where at its core, I want to take out only two things. I want to take out the loose skin, and I want to take out the fat underneath that skin. So what I do is I'll do a general liposuction in the leg wherever I need to, but I focus in on that area of the inner thigh where I'm going to remove the skin, and I lipo like crazy. I lipo from the just underneath the skin all the way down to the fascia or covering of the muscle. The reason I do that is, unlike normal lipo, where you always want to keep a little covering underneath the skin, we identify the areas where we're going to remove the skin. We don't care about keeping fat there. We actually want to get rid of all of it, so we create a nice space where we will get rid of your skin. After I do that very extensive liposuction on the inner aspect of your thigh, I will literally just cut out the skin in the areas that we identified, peel it off, and close everything together. Now that sounds simple, but it is very elegant in its core. And at its core, what I do is I protect your body's vital structures. By only doing liposuction, I don't have to worry about cutting nerves, cutting blood vessels, cutting lymphatic structures, cutting structural elements of your leg like the old-fashioned way had you do. The old-fashioned way had you chop, you cut out everything. My approach is way more targeted, and as a result, my patients have a recovery that is way more comfortable, way more functional, and way quicker. So these are very important things that we do to give you the best result possible and to give a result that makes often all of the hard work you've put into your body just the best it can be. We've done it. You're an expert on the thigh lift now. Ask me any questions you have in the comments below, and if you want more educational material like this, you know what to do. Follow me, subscribe to the channel, you'll see a ton, and you'll learn.